Hai. Hello guys, welcome back to my gallery, Ayudya, with me, Ayudya. So today I'm gonna tell you about what is Angelman Syndrome. Have you ever heard about that? So if you don't know about it, I will tell you about what Angelman Syndrome is, and then the symptoms, the causes, the examination, the treatment, complication, and also the prevention. So here we go. Angelman Syndrome. Angelman syndrome is a genetic disorder that affects the nervous system. This condition will cause the developmental disorders, including the movement, balance, and speech. Angelman syndrome is a rare condition. This condition is estimated only occur in 1 of 12,000 people. This is the causes of Angelman syndrome. So Angelman syndrome is a genetic disorder that can sometimes be passed on the father or by the mother. And this condition occurs when the UBE3A gene on the chromosome 15 is not formed, it's formed but it's not perfect, it's damaged, or it doesn't function properly. So this is the symptoms. The symptoms usually appear when the child experiences a developmental delays at the age of 6 until 12 months. And some of the common symptoms that may appear are microcephalus, ataxia or balance and coordination disorders, and then speech disorders, crossed eyes, scoliosis, and eating disorders. And children who have Angelman disorders usually is a cheerful person, smile or laugh a lot, and then hyperactive, easily distracted, and some children can experience a sleep disturbance. So this is a picture of a child with Angelman disorders. I'm so sorry because I can't show you the real picture of the people with Angelman disorders because I realized that maybe it's a sensitive issue for some people, and I'm afraid that someone may be offended if I show it. Or maybe I could get a DMCA because I didn't get the permission to show it to you guys. But if you're really curious about it, you can just look it up on the internet. Just write down the keyword that is Angelman disorders, and you will get all of the information that you want to know. And then when we have to see the doctor, so please take your child to see the doctor if he or she has the above mentioned symptoms, especially when the child has developmental delays. To diagnose Angelman disorders, the doctor will ask the parents questions about the first one is the complaint experienced by the child, and then the child medical history, and also the family medical history. To confirm the diagnosis, the doctor will perform genetic tests to identify abnormalities on the chromosome. And the genetic tests that can be done include DNA test of the parents, and then there's a test to check for the missing chromosome 15, and also a test of a gene mutation analysis. And then Angelman syndrome treatment. This treatment aim is to relieve the symptoms and developmental disorders experienced by the sufferer. And the treatment can be divided into drugs and therapy. And the drugs will be given according to the symptoms that arise. And this is the therapy. Actually, there are so many therapies that can be done, but here I will only mention some of them. That is communication therapy, activity therapy, behavioral therapy, and physiotherapy. And then about the complication. If not treated properly, Angelman syndrome can cause complications such as eating disorders, sleep disturbance, hyperactive, scoliosis, and obesity. Angelman disorders is a genetic disorder that is difficult to prevent. For those of you who are planning to have a pregnancy or have a family history of Angelman syndromes, there's nothing wrong with doing a genetic test or screening to determine the risk of developing Angelman syndrome in your child. And that's my explanation about Angelman syndrome. I hope this video can help you to know more about it. I'm so sorry if there's some mistakes in this video, but you can correct me and comment down below. Or also, if you have any questions or want to discuss it with me, you can also comment down below. So that's my video for today. Thank you for watching. Don't forget to like, subscribe, and also give a good comment from me. And I'll see you guys on my next video. See ya!